I'm Kristen Riccio, and today I'll be presenting on schizotypal personality disorder. What is schizotypal personality disorder? It is also known as SPD or STPD. It is a deep-seated pattern of both thinking and behavior marked by unusual beliefs and fears, as well as difficulty in forming and maintaining relationships. What kind of people are those with SPD? Usually they are loners who prefer to keep their distance from others. They are uncomfortable being in relationships. They sometimes exhibit odd and/or eccentric behavior or speech and distorted thinking. And they also have a limited or flat range of emotions. This kind of pattern of behavior can begin early in adulthood. Some symptoms of SPD include feelings that certain external events have an unusual personal meaning, such as that a certain event or feeling is their destiny from God. There's also unusual thinking, beliefs, and perceptions or behaviors, odd or eccentric speech, suspicious or paranoid ideas, bland or strange emotional responses, lack of close friends outside the family, and excessive persistent social anxiety. Some risk factors for SPD can be genetic or environmental. Genetically, schizotypal personality disorder can run in the family, and risk increases if you live with a member of your family that has either SPD or schizophrenia. Environmental factors are affected by childhood traumas, such as abuse, neglect, trauma, stress, and/or an emotionally detached parent. Here's a video of a girl who got diagnosed with schizotypal personality disorder describing the difficulty in maintaining relationships from her own perspective.
Okay, number five. Difficulties with keeping friends and making friends. Yes, I mostly have short-term meaningful or not connections, and there are some reasons for that. So reason number one, I withdraw, but I withdraw when you get too close to me, and only in case if you kind of try to make me edible, digested. So when I see that you do not understand me, but you think that you do, and you do not even have this thought that you don't understand me, that you are not even close. So yeah, it kind of offends me. Then the next reason, I don't want to hear any advice, any your opinion what I have to do with my life or in some situation, just because you do not live in my head. And if I do not ask to give me some advice, please don't, because in this case I can become really antagonistic and severe. Then the next reason, people do not accept me. This is true. So they say that I'm too much, that I'm too negative or too intense. Although you are too much. Then, and the last reason, I just don't like anything fake. If I see that this communication, this relationship goes on some superficial level, I'm going to withdraw. It's better for me to stop. I'm not interested in such type of connection. So then
in this slide, I will discuss the diagnosis and duration of the personality disorder. For diagnosis, individuals are diagnosed on the basis of a person's symptoms and history, typically by a mental health professional. There are no laboratory tests, and professionals will tend to look for signs of a mood or anxiety disorder or the presence of psychotic thinking. The duration of schizotypal personality disorder is long-lasting, often lifelong, and the symptoms tend to be consistently present rather than occurring in episodes, such as anxiety. SPD is often treated with a combination of medication and psychotherapy, such as behavior modification and talk therapy. Behavior modification is used to alter a particular undesirable negative behavior through the use of a system of positive or negative consequences. With repetition of this type of therapy, an individual learns the correct set of responses for any given stimulus. With talk therapy, it can help people develop social skills in order to better cope with social situations. Medications can also be prescribed if there are obvious symptoms, such as illogical thinking can be treated with antipsychotic medications, usually in low doses, and if there are symptoms of depression or anxiety, the doctor can prescribe antidepressant or anti-anxiety medications. In this slide, I would like to discuss the difference between schizotypal personality disorder and schizophrenia, as some might think they are the same thing. Schizophrenia is a more intense mental illness where people may and do lose sight of reality. Schizophrenics can experience hallucinations and psychotic episodes. People with schizotypal personality disorder can usually differentiate between reality and distortions, whereas people with schizophrenia struggle to do so. This fact indicates that people with SPD have a possibility of experiencing delusions, but they are not nearly as intense or frequent. These individuals can also later develop schizophrenia if SPD is developed earlier in life compared to later. Here is a video that helps in explaining the differences between SPD and schizophrenia.
So clearly here there seem to be some similarities with schizophrenia, right? Especially in thinking and beliefs. But we have to be careful because STPD is definitely very different from schizophrenia. So let's say that someone has this superstitious belief with this rabbit's foot, and that they have to have it with them whenever they take a test, or else they won't do well. If this person also had STPD, they might reconsider whether they need it or not after taking the test and doing really well without it. If this person had schizophrenia, their belief in this is set, regardless of what happens, and they won't consider changing their beliefs even if they did really well or better than usual. So with that said, these thoughts and peculiar beliefs aren't typically full-fledged delusions with STPD, and these patients don't have hallucinations either. If they did, they'd likely be considered for a diagnosis of schizophrenia instead. And in general, STPD does not progress to schizophrenia.
Here are a list of references that I used to help me in researching schizotypal personality disorder. Thank you.